In the past couple months, I've just been playing tennis casually with my wife, and I've been noticing that you use your quadriceps quite a bit when you're playing tennis. Recently, I had a client who was having knee pain in her left knee when playing tennis. She played doubles competitively, and she's in her 60s, and she's describing a pain in the front of her knee around the kneecap and around the end of her quadricep. We did an assessment and she had what's called a positive Thomas test. The Thomas test is a way to measure the length of the quadriceps and the rectus femoris. And that's a muscle that crosses the knee joint and it crosses the hip joint and it can get really tight. And I wanted to share the story with you because she got great results with physical therapy and the treatment that I have been providing to her and the home exercises that she's been doing have really been helping her. And I think they can help you too. If you are dealing with tightness in your knee, if you're feeling like your quadriceps are pulling on your kneecap, and if you're having pain anywhere along the front of your thigh or in the front of your knee, then this is something that could help you. After we found that she had that positive Thomas test, we started doing some contract, relax stretching for her rectus femoris and for her quadriceps. The contract, relax technique is a way to get the quadriceps and the rectus femoris to basically relax. Since she's quadricep dominant, her quads and rectus femoris tend to be tight. We also did some soft tissue mobilization to her quadricep and the rectus femoris. This is mostly done by me, but I could also instruct her in how to do self-mobilization of that soft tissue. This is something that can provide a temporary benefit, which allows you to have this window of opportunity to do more dynamic stretching and then strengthening of the quadricep and the rectus femoris and the glutes and the hamstrings. The reason why you want to strengthen the glutes and the hamstrings, these are known as the posterior chain muscles, is because they're going to help to normalize the tone that is in the quadricep. Sometimes if you just use one muscle group instead of the antagonistic muscle group, then that first muscle group is going to get dominant. So again, the quadriceps can get dominant, the glutes and hamstrings could be weak, and then you just tend to overuse the quads because your body usually will take the path of least resistance. And if it's easier to move using your quadriceps and putting pressure more on the knee, then you'll usually do that because that's a position of stability. But what we want to do in therapy and with exercises is to strengthen the glutes because that's going to take the pressure away from the knee. With this client, in the first few sessions, we primarily focused on more of the dynamic stretching and working on some of that soft tissue mobilization. And we worked on activating and recruiting her hip muscles, not only with bridging, but we also worked on lunging and doing some sidestepping. Initially, this started with just light load, mostly starting supine on her back and focusing on the bridging and using her hamstrings and working on her posterior chain. Once she was able to do that, and she did that for 1 or 2 weeks, then we transitioned into more of the weight-bearing exercises where she could focus on exercises like sidestepping and lateral stepping up a step or going anterior on a step up. And these are exercises that you can do to strengthen the quadriceps and to strengthen the hips. When we looked at her form with those exercises, we saw that she was mostly using the quads and the knee. The knee was really going over the toe, which is not wrong. But if you're trying to take pressure away from the knee, then you might want to distribute more of that weight to the hip joint and hinge forward at the waist and use more of the glutes that we were talking about earlier. So with the step ups and the lateral step ups and even sidestepping, we're able to have her hinge forward at the waist, which is going to use more of her glutes. And then we're going to limit the amount that the knee goes over your toe, over her toe, basically just going knee right to the toe or knee behind the toe. And this is going to encourage her to use less of the quadriceps and more of the glutes. Within 2 sessions, this client was feeling 50 to 75% less pain in her knee. Her quadriceps were still tight. She still had a positive Thomas test, but she was playing tennis better and she wasn't complaining with as much pain. Within the next 2 sessions, she was out of pain completely. She was still feeling a little bit tight in the quadriceps, but it's much better. The Thomas test is almost normal now. And we're just training her movements with lateral movements and having her practice different sport specific exercises like doing a forehand or a backhand hit in tennis while using this more hip dominant strategy. Hopefully, this story of my client inspires you to do dynamic stretches for your quadricep and rectus femoris when you're playing sports like tennis. If you feel tightness in your quads and you're feeling anterior knee pain, then it's possible that you're overusing your quadricep and you're getting some patellofemoral pain. That is pain coming from the kneecap pushing into your femur. And you may not be tracking your kneecap properly. This could be because of some deviations in your movement. And a good idea would be to seek out the care and the guidance of a physical therapist who can assess your form and who can look at the tightness, whether or not you do have tightness in your quadriceps and the rectus femoris, and also assess for your posterior chain strength to make sure that you have adequate strength in your glutes and in your hamstrings to counterbalance the usual quad dominance that people have when they play tennis or other sports. If you need more assistance, then you can head to my website, drmarkrobinson.com. And if you need any guidance, then you can talk to your doctor. You can ask for a referral to your local physical therapist as well and go through your insurance. But after you finish that traditional physical therapy, you might want to do some more sport-specific training, and some physical therapists can help you with that. That's something that I like to do for my clients as well. If you feel like your knee has some inflammation and it's swollen, there's different ways to manage that, but one way to manage that is by taking a high dose turmeric supplement. If that's something that interests you, you can head over to activeatoms.com to learn more about that and just make sure that you're cleared by your doctor to take a turmeric supplement. If you have any questions, leave a comment below and I will see you soon.